the exam, I am going to be looking at the skin. I'm going to notice color, texture, and any lesions. Oh, and also, you know, then when you get to the nails, you're going to want to state that you're checking for capillary refill and evidence of clubbing. So you'll just say that. You don't have to go the first, it's not a logical step, the first thing, inspect the whole skin. So you just want to state that you're going to be checking that as you go. So then your first part is going to be the head and face. So you're just going to kind of inspect the hair, you know, and palpate, you know, say, you know, just say it's within normal limits, you don't see anything. You're going to palpate the TMJ and facial muscles. So you're just going to do, you know, the same thing you did before, just kind of palpate, ask the person to bite. Good, open your jaw against resistance, right? Because that's the cranial nerve test. So you're going to do that. You're going to assess light touch sensation of forehead, cheeks, and chin. So you're going to do the same thing. Can you close your eyes, right? And you're just going to have, you can have your Kleenex, or you can just do kind of, tell me when you feel something.
Yeah, no.
And we're just going to go to all of the, with light touch to all of the areas that are.
So you could just have them open up their jaw, you know, chew, smile, you know, raise your eyebrows, and then that's 5 and 7 right there. And then the light touch real quick, and that's 5 and 7.
Okay, so and then for eyes, you're just going to inspect the eyes. You're going to check, you're going to just say, you know, their pupil size is normal, however much it is. So you can say, you can look on here, pupil size is 4 millimeters.
So hold on, just before that though, you do want to verbalize that you're looking at the conjunctiva, sclera, and iris, and, you know, maybe something that, you know, it's clear or not reddened, no jaundice noted, whatever.
Yeah, so basically when you're doing inspection, you can't tell what you're doing, so you just want to say.
You want to verbalize what you're looking for.
Okay, so then you're just going to check their reactivity to light on both sides, and we'll just, you know, make sure you're using a good technique.
Oh, just to clarify that, cross out corneal light reflex, cross out cover test. Okay, for the EOMS stands for extraocular movements. All we're doing for those is just like in our checkoff. We're doing just like what she did. The perla, and then the 6 cardinal positions of gaze.
So basically, for the eyes, you have inspection, and then you have 2 tests. You have
run through the confrontation test.
Oh yeah, I'm sorry. Missed that,
The when do you see my finger? Tell me when.
Yeah, and then another one is you can just have like how many, like look straight ahead, like how many fingers do I have out or something like that, you know?
Oh, wait.
Kind of peripheral vision. Yeah, peripheral vision.
Test. Yeah. So yeah, sorry, 3 tests. We're gonna have 3 tests.
Sorry.
So you have confrontation, the cardinal positions of gaze, and then the perla that you're gonna check with the eyes. Okay. Now for the ears, you're gonna inspect and palpate the auricle, so like around the ears. You're just gonna look, say what you're looking for, and just kind of palpate, make sure everything is normal.
Knowing that cancer in males is, you know, very prominent, so just, you know, no lesions, no masses, you just verbalize it. And then hearing.
Hearing, so you can assess hearing. You can do either the whisper test, or you can do if you have watch that ticks, you can do the watch ticking. Okay, so for mouth and pharynx, you just want to ask, that's where your tongue depressor comes in. So you're gonna use your light. You're gonna ask the person, can you open your mouth please? Good. Lift up your tongue, because you want to be able to look underneath. And then you're gonna say, can you stick your tongue out a little bit? Say ah. And you're gonna do the same inspection that you did for the cranial nerves.
again, just verbalizing, I see the rise of the uvula, it's midline. And then small. You just ask them to swallow.
And tongue symmetry and movement. So you're gonna ask the person to move, move your tongue to the left, move it to the right, up, down, and you just wanna inspect her tongue symmetry and movement that way.
Now you got it.
Okay, so again, for the neck, you're just gonna inspect, you're gonna palpate both back and front of the neck. So you're gonna palpate the cervical spine, the front, you're gonna be checking the lymph nodes, right? And then you're gonna palpate the carotid pulse. Remember, you only check that on one side. And you're gonna assess the range of motion and strength of the neck and shoulder.
And it says if indicated, listen for bruits, so we're not.
Hopefully shouldn't be indicated for anybody in the class.
Yeah, but just verbalize it, if indicated, I would check for bruits with the bell of my stethoscope.
Okay, so range of motion and strength of the neck and shoulder. So we just did this one. So remember, shrug against resistance. Can you turn your head this way? You're gonna you just want to use resistance at the same time. It's just kind of a time saver. And that way you can also kind of see their range of motion. All right, for the upper extremities, you're just gonna inspect and palpate. So this is really, you're looking, at the musculature, things like that. You're just gonna inspect and palpate. You'll do that on both sides. And you wanna check range of motion and muscle strength. So you're just gonna ask the person to do movement. So lift your arms up, good, down in circles, good, and then bend your elbows, straighten them, flex your fingers. You just wanna check all of the joints in the arms. You wanna assess the radial and brachial pulse. So you're gonna check you'll check the brachial pulse. You can check right here, radial pulse. You'll check it right here, and you just want to state which pulse you're checking when you check it. Okay, and then if you choose the gown option, you're gonna open the gown, expose all of the back, but leave the gown on the shoulders and chest. Otherwise, you just will need to lift up to expose the back. And what you're gonna do is you're just gonna palpate the back muscles and the scapula. Make sure everything is normal. You're gonna palpate the spine. Just state that you're checking for anything out of the ordinary. And you're gonna check for the CGA tenderness. So you're gonna, you remember that. That's part of today. And you're just gonna ask the person, does that hurt? Does it feel tender? Okay. All right. Okay, and then while you're on the back, you're gonna get to the lungs. So you're gonna do this, or kind of turn around so everyone can see. Okay, so you're gonna check for the symmetrical expansion. So you're just gonna take a deep breath. Good. Okay, and then tactile fremitus. So you're gonna ask the person to
99, 3. And you could do it at the same time, you could do both sides.
Yeah.
99, 3 or 4 times.
And you're gonna percuss the lung field. And you just want to state that you're listening for resonance on the lung field. That's what you would want to
Make sure you show proper percussion technique and that you're doing it in a logical order. You don't have to do it, remember all the times that they did it in the video, but 3 times on each side.
Okay, so then you're